Shall I start?
Yeah, please.
Good morning, everyone, and very warm welcome. I'm here to present my topic, comparative study between decryocystorhinostomy with bicanalicular intubation and decryocystorhinostomy using mitomycin C, no financial interest. So decryocystorhinostomy is surgical procedure to create drainage between lacrimal sac and nasal cavity via bony ostium, and external DCR is considered gold standard with success rate of 90%, while 10% cases still fail. So the aim of present study is to prospectively and comparatively explore the efficacy of bicanalicular intubation in DCR over DCR using mitomycin C in preventing recurrence and also compare the surgical outcome. This was prospective study done for 2 years in 28 patients presenting to OPD with symptoms of NLD obstruction and chronic decryocystis. Of 28, 22 females and 6 males that were randomly divided into groups of 14 each, and in group 1 of 14 patients, DCR was done with bicanalicular silicone tube intubation, and in group 2, DCR was done using intraoperative mitomycin C. We included the 20 to 60-year age group NLD obstruction and chronic decryocystis, and cases with acute decryocystis, nasal pathology, canalicular obstruction or previous drug surgery were excluded, and preoperative evaluation for local ocular or the ENT evaluation done. Curvilinear skin incision of 10 to 12 mm was given along the anterior lacrimal crest, and we created 12 mm into 12 mm osteotomy site. In group 1, bicanalicular silicone tube intubation done through upper and lower puncta, and drainage tube was tied to 5 external layers by 5-ethanol. And in group 2, 0.2 milligram per ml mitomycin C soaked cotton sponge were applied over the osteotomy site under the surface of lacrimal mucosal flap 1 by 1 for 4 minutes. We did nasal packing, removed after 24 hours, and patient were followed at first week, first month, third and sixth month. And intubation tube was removed at 4 week, and patency of NLD was confirmed by syringing. We used the SSP software and chi-square test. So the patient undergoing canalicular intubation DCR, in results, DCR with bicanalicular intubation, 13 out of 14, that is 92.9% patients showed the successful DCR with reference to relief from EP4 and successful syringing at the end of 6 months. And in group 2, DCR with mitomycin C, 85% patient, that is 12 out of 14, showed the success, and 2 cases failed. However, the p-value is not significant. Maximum incidence was found in 31 to 40-year age group, and 78% were female. There was female preponderance in both the group due to narrow limb of lacrimal bone, canaliculi, NLD, hormonal, and also the osteoporotic changes. And success rate is more in bicanalicular intubation. And the success assessment criteria is EP4 and successful syringing at end of 6 months. And the commonest cause of DCR failure that we encounter are obstruction at common canalicular osteotomy site closure that is well solved by the silicone tube that prevents the blockage and allows the epithelial tract to form around the tube. And on mitomycin C, antiproliferative agent prevents scarring. So our study has a limitation of being small in sample size, and also the duration of follow-up is short. Thus, our study suggests that by DCR with bicanalicular silicone tube intubation yield more success rate than the DCR with mitomycin C, though mitomycin C is also the effective results, and bicanalicular intubation can provide the additive beneficial effect in canalicular obstruction, punctal problem, osteotomy site closure, and preventing the recurrence. Thus, DCR with bicanalicular intubation can be good choice of surgery for the NLGO cases. These are my references, and thank you so much.
Or in each and every cases, intubation or either intubation or MMC?
Sir, in our cases, we found that the DCR with intubation is having the more success rate than of the mitomycin C. We randomly selected the primary cases of NLD obstruction and chronic decryocystis, and we divided into group. And for one group, we went for the DCR with intubation, and second, mitomycin C DCR was done.
That's you already informed.
Yeah.
I want to know: are you advocate for each and every cases either for silastic intubation or MMC?
Sir, this is something quite debatable, having varying view. Some surgeons prefer that in the failure cases or the repeat cases, DCR is more successful with the intubation. But a few of the studies, also the study by Dr. Javed Ali sir, and there is one study of the 20-year retrospective study in the patients, which suggests that also the primary cases, or in maximum number of cases, DCR with intubation, if selected, good case selection is done, is a very good choice of surgery.
Okay, as it is a competitive session, I want to ask another question, that tell few complication of silastic intubation.
Yes, there are the complications of celastic intubation. One is also the granulation tissue formation, maybe the loss of the tubes, or maybe the laceration of the canals. However, to prevent the loss of the tube or incorporation of the patient, we selected the 20 to 60 year age group to have the cooperation of patient, and excluded extreme age of patients.
Okay, thank you.
So we removed the intubation tube at 4 weeks. Beyond the 4 week, there is biofilm formation has been reported in the various studies. So it will itself go into various complications if we prolong the timing. So 4 week was our removal of intubation.
How much percentage of mitomycin was used and for how long?
Yeah, ma'am, 0.2 milligram per ml mitomycin C was used, and it was used for 4 minutes. Various concentrations of mitomycin has been tried, and we found that the 0.2 milligram per ml concentration, for which we keep it at the 4 minute at the various sites to
So
prevent
for
the
all
scarring and
patients, it
fibrosis.
was maintained.
Yeah, yeah.
What type of randomization did you do?
Yeah, ma'am.
What type of randomization did you do?
I didn't get it, ma'am.
What type of randomization did you do to split it into 2 groups?
So, ma'am, it was a double randomization. We did not had the matlab, which of the patients are going in which criteria, and
So what's that name?
double randomizations.